Hi, I'm Graham Ewing, Chief Executive of MyMex Montague Healthcare. I'm author of over 80 articles which have been published in peer-reviewed medical journals or which have been presented at medical conferences. I have a rating of 15.83 on ResearchGate, which places me in the upper 40% of medical researchers. At present, my work is immensely popular. This presentation focuses upon the dominant theme of my work, that is, that cognitive changes reflect pathological onset and can be used as the basis of a mathematical model of the autonomic nervous system and physiological systems, and how this can be used to screen and treat the diabetic patient. The misdiagnosis of diabetes remains a significant problem for the endocrinologist. In this presentation, I will speak about the subject neuroregulation. In particular, the neuroregulation of blood glucose levels. That is, that blood glucose is a neurally regulated physiological system. The diabetes can occur in patients who have a normally functioning pancreas, and that type 1 and type 2 diabetes invariably occur as comorbidities. It is inevitable that type 1 and type 2 are comorbidities. Type 1 is the genetic condition by which the genes express insulin, or if you prefer, preproinsulin. The type 2 process is the process by which the expressed protein reacts with its receptor protein. One follows the other as surely as night follows day. The problem of type 3 diabetes, the multisystemic chronic condition, is an advanced complication of the condition in which comorbidities develop in other systems and organs, for example, in the heart, in the kidney, the liver, and in the circulatory system. Accordingly, an inexpensive test is required which is able to determine the rate of genetic expression of preproinsulin and insulin, the type 1 process, which can determine the rate at which the expressed insulin reacts with its receptor protein, type 2, and which can determine the complex pathological correlates of the condition, type 3. This is an enormous problem for the medical profession. To screen for the range of complex correlates using contemporary biomedical indices will add immense cost to the diagnostic process. However, there is one technology, stranic virtual scanning, which is able to do so at much lower cost than any current technology.
Stranic is the first medical technology to be based upon a precise and sophisticated mathematical model of how the brain regulates the body's function. How the brain regulates the autonomic nervous system and physiological systems. In this presentation, we will introduce the basic concept and principles upon which the Stranic technology is based. We will illustrate what Stranic is and what it can do, and we will discuss the use and outcomes of its two main programs and applications: the medical screening modality, Stranic virtual scanning, and the neuromodulation therapy, Stranic light therapy. In particular, we will discuss the significance and value of it in the diagnosis and treatment of diabetes and obesity. This presentation is part of a series of articles regarding diabetes by the author. Let me dwell on several of these papers for a moment. The first one, a different perspective on diabetes and obesity, what it is and how it can be measured. The second one, the interpretation of genetic data, considering the effect of changes to gene conformation. If the facts don't support the theory, change the theory. And how does this contribute to understanding diabetes? Third one, neuroregulation of blood glucose. The fourth one, neuroregulation of blood glucose. The fifth one, a review of the genetic and phenotypic nature of diabetes mellitus. The medical profession, in general, considers this to be how the body functions. It doesn't take into account how the brain actually influences and regulates how the body functions. So the challenge for medical researchers is to explain how the brain regulates the body's function. And in order to address this fundamental issue, the European Commission instituted at a cost of 1.2 billion euros the Human Brain Project, which has 13 sub-projects intended to address three fundamental aims and objectives. That is, identify what the brain does and how it does it, develop a new generation of cognitive screening technology with particular emphasis on determining the complex pathological correlates of conditions such as Alzheimer's disease, and thirdly, to understand and adapt with therapeutic effect the multi-level nature of brain function. Now, there are numerous precedents for neuroregulation. Sports physiologists and neurologists recognize that the brain continuously regulates the body's function and systems in periods of physiological excess. That the brain continuously regulates the body's function during extremes of exposure to high or low altitude, temperature, pressure, acidity, and so on. That stress which we experience through the senses, and hence through the brain, has pathological correlates. That elevated blood glucose levels are not solely due to pancreatic dysfunction, but are neurally regulated and have multi-systemic and multi-pathological origins. So, this is how the senses function. What we see through the eyes, what we smell through the nose, what we hear through the ears, and what we taste influence what we eat. So the structural nature of the autonomic nervous system is based upon there being sensory input which influences brain function, which determines how we behave. And this simultaneously, the brain is coordinating its dialogue with the visceral matrix, that is, the networks of organs in the body, and hence, which takes into account changes of molecular biology introduced by nutrition, by what we breathe, and also by our exposure to viruses. Looking to the right, we state that the brain determines how the physiological systems function, how the organs in each system function, how the cells in each organ function, and how the molecular or pathological changes influence cellular biology. There are various precedents for the technology, or should I say advocates. Dennis Noble, respected systems biologist at Oxford University, who developed the first mathematical model of brain function, has written about the necessity to take into account the relationship between systems, organs, cells, and molecular biology. Nobel laureate Eric Kandel has recognized the significance of sensory input in an article published in Scientific American in 2006. Nobel laureate Sidney Brenner has written articles entitled Top-Down, Bottom-Up, or Middle-Out. So he's contemplating how the brain and the organs of the body correlate together. Respected geneticist Eric Lander, who is accredited with leading one of the teams which decoded the human genome, was quoted to say, "We have the parts list. Now we need the operating manual." So what do we mean when we refer to bottom up or top down? The neurological paradigm or the biomedical paradigm. Consider whether to treat the patient's symptoms and hence influence brain function, as the pharmaceutical companies do when they give psychotropic drugs, or modulate how the brain regulates the coherent function of the organ networks and organs, the top-down approach propounded by neurologists. So what are these physiological systems? Well, these are networks of organs. To put it into context, a doctor's preliminary examination is based upon a rudimentary knowledge of the autonomic nervous system and physiological systems. He will measure blood pressure. He will test for blood glucose levels. He will look at blood volume. He might ask the patient to take a breathing test. He'll ask whether the patient is eating or urinating satisfactorily. He'll test the urine for its pH. He will take a body temperature. He will assess posture, he might ask about sexual function, and he will ask about sleep. Each of these are physiological systems which are characterized by the prefixes hyper and hypo, like hyperthermia or hypothermia. Now the organs in a typical organ network, as defined by Dr. Grakov, the technical director of Mymex Montague Healthcare, are as follows. I've used two of the organ systems as examples. For the regulation of blood glucose, the organs which are involved are the brain, pituitary gland, thyroid gland, adrenal gland, the liver, the pancreas, of course, blood and peripheral vessels, small intestine, and kidneys. So, if there are pathologies in any of these organs, it will influence the brain's ability to regulate blood glucose levels. If there is pathologies in the regulation, in the organs and the regulation of intercellular pH, these are brain, pituitary, thyroid, adrenal glands, liver, pancreas, blood and peripheral blood vessels, lungs and bronchi, skin, stomach, duodenum, small intestine, large intestine, and kidneys. That will influence the body's function, in particular the levels of minerals, which are factors in the metabolism of blood glucose. So bearing this in mind, how does the body function? A doctor's training is largely based upon biomedicine. However, the biomedical paradigm cannot yet explain many things. For example, how such organ networks function in a coherent manner, the function of the neural networks, how stress often has pathological correlates, how the autonomic nervous system functions, how proteins are genetically expressed, the relationship between genotype and phenotype, etc. What are we missing when we consider diabetes? Take a typical chemical reaction. Chemical A reacts with chemical B. It requires energy to make that react, to make those chemicals A and B react. That will result in chemicals C, or products C and D, plus the release of energy. Now if we apply that to the biological context, we can see that genes express proteins. Well, that's a chemical reaction. The transcriptase enzymes, which are implicated in genetic expression, often require magnesium and zinc. And they are dependent upon the prevailing level of intercellular pH. Proteins may be coiled or uncoiled. We see this in diabetes as insulin resistance, and it can also be expressed as leptin resistance and ghrelin resistance. So it applies not just to one protein, but to all proteins. Because proteins are polar entities. Thirdly, proteins react with their reactive substrates, and in the process of doing so, they emit biophotons of light. This emission of light influences our color perception and explains why changes to color perception accompany the onset of diabetes. In fact, they accompany the onset of pretty well all metabolic processes. Drugs, vaccines, viral infections, all are accompanied by changes to color perception. And moreover, it's a digital measure of pathological onset from its pre-symptomatic origins. Every biophoton released is the equivalent to one reaction, one pathological reaction. If we have 100 biophotons, we have 100 reactions. If we have 1,000, we have 1,000, and so on. The sixth point, insulin is released by the pancreas in a pulse every 3 to 6 minutes. It's neurally regulated. 7. Glucose is converted into energy in the smooth muscles, which is a chromium-dependent reaction. And of course, chromium is dependent. The redox state of chromium is dependent upon the acidity. Number 8. The optimization of blood glucose is conducted by a network of organs, and hence that pathologies in any of these organs will influence blood glucose levels. Significant destabilization of other organs and other systems, for example the sexual system, which would happen in a woman who's had a hysterectomy, will influence neuromodulation of systemic stability by the brain. Changes of protein conformation, that is the coiling of protein, will influence appetite and satiedness. And of course, changes of acidity will influence whether a protein remains coiled or not. And then finally, the stomach expands. So as our appetite, due to levels of leptin, and our feelings of satiedness, due to the levels of ghrelin and insulin as well, become dysfunctional, then we eat too much and drink too much of the wrong things, and our stomach expands, and with the consequence that we become obese. So type 1 and type 2 diabetes are coexistential morbidities. They occur at the same time. They have to, because the first step, the type 1 diabetes, is that the genes express insulin, and the second step is that that insulin reacts with its receptor protein. Now, this is accompanied by changes of blue-yellow color perception, and this is a widely noted and commonly studied aspect of diabetes. About 40 genes are known to be associated with the genetic expression of pre-proinsulin, which is the precursor of insulin. The rate of extent of our expression of insulin determines whether we have type 1 diabetes, yet our production of insulin declines as we age. So as our genes are less able to express our protein, we naturally become more predisposed to diabetes. The expression of pre-proinsulin is a biochemical reaction, as stated earlier, in which transcriptase enzymes often require magnesium and zinc. Insulin is a polar entity. The reaction of insulin with its receptor protein is known to be a magnesium-dependent reaction. Therefore, it's a pH-dependent reaction. The prevailing intercellular pH influences the availability of magnesium, zinc, and chromium, which are essential for the insulin storage, as in the case of zinc with the zinc hexamer, its reaction with, as outlined, that the reaction of insulin with its receptor protein is magnesium dependent, and the subsequent metabolism of blood glucose, which happens in the smooth muscles, which is a chromium dependent reaction. The neuropulsatile release of insulin is influenced by its intercellular environment, so pathological onset lengthens the periods between each pulse and lessens control over blood glucose level. So the therapeutic significance of light and frequency is influenced by is reflected by changes of color perception, which have diagnostic significance, that light has a photoactivating effect, the light enhances protein coiling and enhances protein reactivity, that the brain uses frequency to regulate the coherent function of the autonomic nervous system and physiological systems, yet pathological change influences brain function and hence the neuroregulatory process outlined earlier. Of these systems and frequency states, the delta state is most significant because it's where more than 50% sleep is conducted in. If you have poor levels of the very deep delta sleep, you just don't have such a good level of health or recovery the following day. So the basic principles are that changes of color perception in particular have pathological significance, that proteins and other biologically active substances absorb and emit light, and this can be used both diagnostically and therapeutically. Secondly, the eye responds to as little as 7 times 10 to the 2 biophotons per second, so it's an immensely sensitive detector. That the brain is a biophysical entity which uses frequency to monitor and regulate the body's complex multi-level function, and that our behavior is the consequence and the output of this complex process. So this is the principles upon which our Stranic technology is based. Stranic is a suite of software programs, algorithms if you prefer, which are based upon a mathematical model of the autonomic nervous system and physiological systems. It comprises Stranic virtual scanning and Stranic light therapy, and meets almost in its entirety the key aims and objectives of the European Commission's 1.2 billion funded Human Brain Project. The earliest origins of the technology were in the early 1980s, where Dr. Grakov presented a paper, a confidential paper, to the Presidium of the Siberian Academy of Medical Sciences in 1985. Dr. Grakov's work was subsequently validated by Professor Yuri Vysochin, who at the behest of the Duma, the Russian parliament, conducted a quite extensive research program, and this resulted in the initial approval of the technology for use in the Russian market in 2001. So I've commented earlier that there are about 80 published peer-reviewed papers which are available on LinkedIn, on ResearchGate, and so on. Some of these papers I'll bring to your attention here. We've compared the aims and objectives of the Human Brain Project with our Stranic technology. We've pointed out limitations of the Human Brain Project. we've illustrated how it can be used to screen for the pathological correlates of Alzheimer's disease, or even of randomly clinical studies illustrating how it can be used to screen the health of a randomly selected cohort of patients. This was conducted by, first of all, Dr. Juan Carlos Duran in Gran Canaria, and the second study was conducted by Dr. Rakesh Mohanlal and colleagues in Durban, South Africa. So the technology is a digital technology. The emission of biophotons is a digital phenomena, whereas most diagnostic medical tests and technologies are experiential, analog, and have significant limitations. Limitations which don't affect our Stranic technology. Most apps seek to convey the same analog data sets by digital means. They're not actually digital, they're analog, or if you prefer, digitally enabled, but they're not digital. Stranic is based upon the understanding the body functions as a digital entity. It's a neurosimulation approach, and it uses a cognitive games-like technique and which runs on most personal computers. This is an illustration of what the test looks like. There's a demonstration video can be found on our website. So a Stranic virtual scanning report provides a considerable amount of data about the patient. We have selected several pages from the full report in order to demonstrate the scope of the technology, to establish the most destabilized or functional physiological systems and the pathologies which are present in each organ, and each pathology being defined in terms of its gene type and its phenotype. So here's our first example. We can see that the system which sustains optimal sexual function is most destabilized. That of the organs in the system, the blood and peripheral blood vessels and prostate gland and other sexual organs are heavily destabilized. We can see on the top right hand side that if this person continues their current dysfunctional lifestyle, that there will be the probability of further pathological onset in these organs, the brain, duodenum, down to the urinary bladder. The second slide here illustrates how we can determine the morphological situation of the organ. I don't intend to dwell on this. So the most important thing from a doctor's perspective is how it can be used to screen a person's health. And here's an example report of the pancreas. And you can see on the right-hand side, the signals 20 and 5, which are the diabetes signals. So in this particular example, the patient has 20 units of type 2 diabetes and 5 units type 1 diabetes. It's important to note that from 0 up to 10 units, the signals are at the pre-symptomatic level, and from 10 units and upwards, they're at the symptomatic level. So above symptomatic is what you would normally expect to be determined by contemporary biological tests. Let me repeat again, the red signal as your phenotype, which in diabetes is the type 2 condition, and with the blue signal is the genetic signal, which in diabetes is the type 1 signal. We can see here how we can determine cardiac infarction, cardiac myopathy, cardiac arrhythmia, angina pectoris, cardiosclerosis, and cardiac insufficiency, and many more cardiac pathologies, all in one single cognitive test. In the third example, in the brain, we can see in the middle the genetic signal for encephalopathy, which would accompany damage or degeneration, and would be a typical marker for dementia or brain injury. So we've decided, we have selected a specific case study to discuss with you. First of all, we'll look at how Stranic virtual scanning was able to determine the most destabilized system, and in this particular case, it was the patient, as a Chinese gentleman, the system which sustains optimal position of the body in the environment. The person had significant problems with their spinal cord, which have influenced how they slept, and this was leading to the onset of Alzheimer's disease. The second slide illustrates that there is a red deviation on the Hayflick limit, which illustrate the presence of processes which have psycho-oncological, or if you prefer, just simply oncological significance. So we're looking more closely at the brain. We can see the presence in the middle, 9-4, where the arrow is, in the presence of encephalopathy. This person had cognitive impairment, and this was reflected in the results here. They had a very, very large signal for spinal arachnoiditis. In the third slide, and they had the onset of diabetes. So we can see already the two key markers for Alzheimer's disease, encephalopathy, and diabetes, type 2 diabetes in particular. Third slide is of radiculitis, which is consistent with the earlier slide of spinal arachnoiditis. The person was having problem breathing so well, and here we see the presence of bronchial asthma. They had a kidney infection. Because they were no longer so active, they were showing signs of inactivity, in particular, in this case, cardiac insufficiency and cardiosclerosis. So that illustrates how we could see the onset of multipathological conditions in this particular patient. In various articles, we've reported how the stranic virtual scanning can be used to screen for diabetes, cardiovascular disease, migraine, Alzheimer's disease, Raynaud's phenomenon, cancer patients, and etc. So please refer to my bibliography for further information. So the stranic technology is a point-of-care concept which is more significant than genetic screening because it doesn't dwell on what genes are involved. It merely dwells upon what the genes do. They express a particular protein. So we can determine pathological onset from the pre-symptomatic onset. We can determine the gene type and phenotype for all common pathologies. That's typically 13 pathologies per organ in each of the 30 main organs. It's more comprehensive. It provides a complete screen, it's non-invasive, it's rapid, and it's extraordinarily inexpensive. We're able to screen the complete health of each patient for less than £5 per medical indication, typically between £15 and £25 per medical test. And we can also offer improved therapeutic outcomes using stranic light therapy. A series of initial studies have reported that stranic virtual scanning is able to determine the onset and progression of pathologies 2 to 23% more accurately than the range of diagnostic tests which are routinely used in clinical testing and against which it was compared. That it's able to determine the onset and progression of many diseases for which there is an unmet clinical need, and that stranic light therapy is typically 83 to 96% in the treatment 83 to 96% effective in the treatment of 30 common categories of disease, which compares with the 50% effectiveness of most common categories of drugs. Stranic benefits. Well, it provides the patient with a screening modality which they can use to better understand the influence of their lifestyle upon their health and hence reduce the number of patients who need to see the GP. So the patient can do the test before they decide whether they need to see their GP. It can reduce the number of repeat patient consultations at the doctor. It enables the doctors to see immediately, or at least to have indications immediately, of where they should focus their attention, and thereby limits the need for histopathology tests to confirm their diagnosis. It provides the GP with a screening modality which reduces their dependency upon secondary care and enables the GP to monitor on a regular basis the onset and progression of morbidities. It enables the GP to focus upon those patients who really need their attention. And it has the option of providing a viable non-drug mode of treatment to complement contemporary methods of treatment. That is, to treat the fundamental neural cause. So examples of stranic light therapy. First of all, to note, stranic light therapy is a neuromodulation technique. It does not treat any particular medical conditions. It acts upon the causal, neurological origins or processes of the condition rather than the symptomatic consequences. Example 1. This is a patient of 76 years who attended for his first stranic test. His condition was of prostate cancer and mesothelioma, and he required assistance to walk. Following chemotherapy, he had severely restricted breathing due to the accumulation of pulmonary edema in his lungs, which required surgery to drain the fluid, but which failed to cure the problem. After 3 to 4 months of stranic light therapy, his health was much improved. His weight had increased by 5 kilos, his breathing was dramatically improved, his eyes were alert, his mental clarity was much improved, and he was happy, in contrast to when we first met him. His prostate condition was also improved. He didn't need to go to the toilet so much. He no longer had any fluid on his lungs, to the astonishment of the consultant. The x-rays showed the complete absence of fluid, and he no longer had chronic breathing insufficiency, which of course you would expect. He could walk unaided, and his overall health was improved. Whereas initially his demise was imminent, he died 1 or 2 years later. That is, he died 1 or 2 years later than forecast by or expected by his consultant. His son wrote to Montague Healthcare expressing his thanks. The second example is of a male, 59 years, with sleep apnea, suffering abnormal sleep episodes which were affecting his ability to drive and work and the quality of his private life. Oxygen therapy was unable to reduce the severity of his symptoms. He was offered surgery to improve his breathing, which was hoped would mitigate the condition. He refused the surgery and undertook several months of stranic light therapy. After 6 months, his consultant advised that he was no longer suffering from the condition. Example 3. Patient with diabetic foot ulcer. A delightful man of 78 years. He was dissatisfied with his GP's diagnosis when he consulted him with a swollen foot, which was the result, diabetic foot ulcer resulting from his type 1 diabetes. He became disillusioned with the diagnosis when prescribed antibiotics, which the doctor presumably prescribed as a preventative measure against infection. He completed a 6-month course of stranic light therapy, during which the swelling completely went away. He commented upon much improved stability of blood glucose levels, mobility, improved energy, dramatically improved quality of life. In fact, we bumped into him at a shopping centre, shook hands with him, and he went on his way. He was able to completely walk around without any impediment. So in conclusion, stranic meets the key aims and objectives of the European Commission's 1.2 billion funded human brain project. Unlike the European Commission's Human Brain Project, it is a fully and completely developed technology. Human genome pioneer Professor J. Craig Venter is co-founder and chairman of Human Longevity, a firm aiming to give us all data-driven health intelligence. What he stated was, we're fighting medical tradition where we wait until people are sick before we treat them. He's raised over $300 million to develop this predominantly genetic testing based company, which intends to charge patients $25,000 per patient per assessment. Yet the majority of drugs act upon phenotype. A course of stranic testing and screening will cost, we expect, between $500 and $1,000 per patient. Make the comparison yourself. It's an ideal technology for the primary care setting. Anyone who wants further information can contact me at these contact details, or you just need to look up the autonomic nervous system on the internet. Look up MyMax Montague Healthcare, look up Graham Ewing, or look up stranic. We can easily be found. Our website contains demonstration video, the operating manual, case studies, and testimonials. Thank you very much for your time. Thank you very much to the organisers of the exhibition for allowing me the opportunity to speak to you today. I do apologise that I'm not able to be present with you. Many thanks. Goodbye.